Okay. I'm showing you how to insert an IV. First, find an appropriate vein. Put the tourniquet on 2 to 4 inches above your insertion site. This is how you put the tourniquet on. Okay. See how I go over and tuck it in. Should be just snug, not too tight, not too loose, just to engorge the vein. You could make a fist. All right. So let's clean it. This is chlorhexidine. Once you clean the vein with this, you must do it the right way. Up and down, up and down. Okay, side to side, at least for 30 seconds. Make sure you let it dry. You really have to scrub it good. Okay, that goes there. Now you can, while letting it dry, prepare your extension set and your flush. 3 ml is good. Okay, make sure you keep everything sterile. Untwist that. Get your extension set. Make sure you don't touch anything and connect it to the hub. Screw it on. And you notice the air. Make sure you raise your catheter so you could push out the air. First, pull back the plunger. Pull it back this way. And then you just push it up. Push up the air up so you don't have air going into the patient's system. Press it into the sterile area and just loosen it up. Make sure nothing touches. Okay? Keep it down there. Now, you get your needle. This is 22 gauge. It's blue. Notice the skin is dry. Don't touch it. Okay? When you insert a line, make sure the bevel is up. See that bevel? Okay, let's put it back. Okay, see that bevel? The eye of the needle is facing upward. Okay, right? So let's start. Please, sir, don't move. Make sure the angle is correct and your bevel is facing upward. The angle is 5 to 15 degrees. All right, I stick, don't move. 1, 2, 3. Oh, we got a tough skin. You see blood? Lower the angle. You push in the catheter, okay, itself. See, you see blood there? All right, I'm going to lock this. I'm going to pull the safety engineer device, release the tourniquet. Now you could put the gauze underneath so you would catch any blood. All right. I would put my distal pressure so it doesn't bleed. Okay. What I'm going to do is separate this. Oh, it's a little tight over here. I cannot see you. Okay. All right. See, make sure you have a distal pressure. It's bleeding like crazy. All right. You have to tighten this up. That's why it's so important that you have your distal pressure. This is non-safety engineered device. That's why it's bleeding like crazy. Now you're going to tighten this up. Okay. All right, let's test it. You aspirate for blood, meaning draw back blood. Make sure that means you're in the vein, then flush it slowly. Okay, pulsatile technique. All right. And then clamp it off before you disconnect the syringe. See, I clamp it off before I disconnect the syringe. Okay, you can clean it up more a little bit. If you have an alcohol pad, you could do that. Okay. The gentleman almost passed out from the blood. You could see he's a little shaking. All right, so make sure you cover the site to keep it sterile. Okay. And it should be snug. There's still blood there. It's good enough. Okay. Hold on to the rim or to the edge so it doesn't lift. And this is your label. You put your date, time, and initial. Make sure you don't cover the site. I would put a tape over here because this is where it moves. So make sure you tape that hub. And then you could also loop it. Loop it this way. I would usually just tape it over here so the site is still exposed. Okay. Are you all right, sir?
Yeah.
You can wake up now.
Very good.
All right, good.
Whoa.
So.
I didn't feel a thing.
Okay, thank you. So now to peel it off, make sure you peel it off, right? Okay. I would see if it's a tegaderm. This has a cloth, but for regular tegaderm, you could just stretch it out. Stretch it out like this, and it removes easily. Now I need a sterile gauze. That's dirty. I need a sterile gauze. It would come 10 years later. All right, so just wait for the gauze. 10 years later.
Honey, I'm leaving with the kids. What? And then I pulled out the vein, and then everything's fine. And that's not included, but that is what happens.
Okay. Make sure you use a sterile gauze when you're removing an IV so you don't infect the person. Okay? All right, there you go. You okay? You live.
My legs. I can't feel my legs. Sorry.
He can feel his legs.
I suddenly am now smelling colors. Orange smells delightful.
Make sure you can take it off in 20 minutes. Okay? All right. You okay? Okay, let's do that again. Did you turn it off?